Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
The best advice when it comes to medication safety is read the label and follow the instructions. But doing that isn't necessarily as easy as it sounds. And the more medications you're taking, the tougher it is to stay organized, keep medications straight, and keep yourself safe from a medication error. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we talk about translating drug labels and organizing your medications. Stay with us. Welcome back. If you've ever found the information on your prescription label confusing, you are not alone. Studies have shown that about half of patients in the U.S. do not always understand the information on medication labels. Joining us this morning is pharmacist Lisa Sather to help us pay better attention to medication information and to translate some of the information that's on there. Thanks so much for being with us this morning, Lisa.
You're welcome, Beth.
So let's talk about some of the information. Obviously, more than just the labels come with a prescription. You get inserts and things like that. But can we start with talking about the labels? What do you typically find on a medication label?
Yes, of course. So it's important for, I think, our viewers to note that medication labeling is regulated by federal and state law. So it's not just willy-nilly what appears on there. So you're going to see things like your name, your prescriber's name, pharmacy information, the pharmacy name, address, and phone number. You're going to see the drug name, strength and quantity, and directions for use, as well as the number of refills that are left on the prescription, when the prescription can be refilled, those kinds of things. You may see, of course, the generic name of the medicine, the brand name. Sometimes these things are going to be abbreviated because they're very long. And some other additional miscellaneous information that shows up are initials of the pharmacist that check the prescription, the technician information. There's just an awful lot. We could spend quite a bit of time just going through each and every part of that, but that's the basics that you're going to find on a label.
So yeah, wow, that is a lot, and some of it can be very complicated, but let's try to start with something maybe a little more simple, the medication name. Why is it important to know the names of the medications you're taking?
Right, that's a great question. So of course, the more you know about your medicines, the better you're going to be able to talk with your physicians about them, and also remember the side effects. That's important to link to the name of your medicines. So that's one important thing, and also you need to know why it's being prescribed, I guess is what I'm trying to say. I mean, that's extremely important. I'm taking this particular medication for my blood pressure. So you need to kind of link that in your mind with the name of the medicine. That's extremely valuable.
Okay. And maybe the most important, arguably, part of the label would be the instructions. Sometimes those can be complicated or a little bit confusing. Can we walk through maybe some of the more common instructions you might see on a medication label? So let's start with take with food. Mm-hmm. So first of all, why do you need to take some medications with food, and how much food should you eat to make sure you're following those instructions correctly?
Sure. So there's a couple of reasons why that's very important when you see that on a label. The first really is a lot of times medicines can be upsetting to your stomach. So if they're taken on an empty stomach, that can come directly into contact with your stomach, and it can be irritating. Some of the most common medicines would be non-steroidal anti-inflammatories. Over-the-counter names for that would be Aleve or ibuprofen. There are other certain medicines that can cause that. Another important reason to take medicines with food sometimes is that they can be absorbed better. Some medicines are much better absorbed with food, so that's really important to note. A full meal usually isn't necessary. You don't have to go down and eat as much as you can, but something like some crackers, a snack, some yogurt, and sometimes even a glass of milk is appropriate.
Okay, great. Well, sort of on that same vein, what about take with water? What does the water do, and why is that important?
Sure, another great question. So water obviously helps to break down the medicine and pass it through into your stomach and intestine where it's absorbed. So that's number one important. Water actually is generally it's a small sip is not enough. So when an instruction says take with water, that means an 8-ounce glass of water.
Okay.
Some medicines that come directly into contact with your esophagus can be very irritating if they don't have enough water to move them through, so that's extremely important to remember.
Okay, great. So a common one is take once daily or take twice daily.
Right.
Is there a certain time of day that is better to take those kind of medications when you get those sort of instructions?
Sure.
And if it's twice, should it be 12 hours apart, even if you have to wake up to take it? Can you speak to that one a little bit?
Really important to talk to your pharmacist about the best time of day to take the medicine. Some medicines are best taken at bedtime, some are best in the morning, so it's going to be dependent on the medicine if it's a once daily situation. Also, regarding the twice daily question, that's typically, spaced out evenly throughout the day. So breakfast and dinner is typically a good time, or morning and bedtime. It's not really necessary to wake up to take medicines if it's twice a day. That's typically not an issue. So you can talk to your pharmacist about what the best times are.
Okay, great. And how about if it just says take as needed? What do you do there?
So take as needed really refers to those medicines that don't have to be taken on a routine basis, that are taken just for certain specific situations that arise. For example, right now it's allergy season. It might be allergies, it might be sleeping, it might be anxiety. So those medicines may say take when needed for a condition, but it's also important to note there's going to be a maximum dose, maximum interval you can take those, but it's important to talk to your doctor about why you have that flexibility in taking medicines as needed.
Okay, great. How about another instruction indicating that you should limit your sun exposure? What do medications like that do, and what are the risks there as far as being in the sun?
Sure, there's a couple different kinds of sun reactions that can happen. One is a photoallergy. That's very rare, but let's talk about phototoxicity because that's a more common type of reaction with medicines. Some medicines actually absorb the UV rays, and it can cause you to experience a severe sunburn. So it's important to know that if your pharmacist says, you need to limit time in the sun, there's a reason for that.
Okay, so what does limit sun exposure actually mean?
Yeah.
Can you be in the sun at all? Does it help if you wear sunscreen?
Sure, absolutely great question. So limit your time in the sun, wear sunscreen that has a good UVA, UVB protection with a minimum SPF of 15, and wear appropriate clothing. That's really important.
Okay, we're just about out of time, but
Sure.
let's hit one more.
Yes.
How about those labels that say avoid alcohol? What could happen if you mix them with alcohol, and can you drink at all?
It's a very good question, and it's always important to talk to your doctor or pharmacist about the specifics of a specific medication that has that warning on the label. Two things. One, alcohol can interact with medicines and basically cause increased side effect risks. So some pain medicines if you take those with alcohol, it can make you drowsy, sleepy, even more nauseated, can cause vomiting. So it can be kind of a side effect situation, but even more importantly, some medicines can severely interact with alcohol and make you very, very ill if you take them together. So that's important to talk to your pharmacist about.
Okay, for sure. Thank you. So we need to pause here for a quick break, but we're just scratching the surface when it comes to making sure you understand what you need to know about your medications to limit your risk for side effects or having problems. This gets tougher for you folks out there who are taking multiple medications. We're going to talk about that and much more right after this. Stay with us.